It's your doctor's top priority to make you feel well-informed and comfortable with your treatment options. If you're watching this video, you're visiting this practice to have your tooth or multiple teeth restored with dental implants. In this presentation, we'll review the expectations for today's appointment, some of the potential risks of restoring your teeth, and the expectations for your recovery. If you have any questions after watching this video, your doctor will be happy to answer them during your consultation. When a tooth is removed or missing, there are several good reasons to replace it. Many people with missing teeth experience shifting of their healthy teeth adjacent to or opposite the empty tooth socket. In addition, the remaining healthy teeth bear the burden of the missing teeth, making them less efficient. Both of these side effects can severely affect the health of your mouth. There are many options for dealing with a missing tooth. Leaving the space empty or utilizing removable options, such as a partial or full denture, are popular options. But these treatments do not stimulate the jawbone. This can cause your jaw to decrease in height or width over time, which poses a risk to the health of your remaining teeth. Using a bridge is another option, which requires the removal of a significant amount of your healthy tooth structure for secure placement. Unfortunately, this can take a toll on your healthy teeth, as they bear the burden of the bridge and absorb the chewing forces that should be distributed between multiple teeth. If you wish to preserve the health of your remaining natural teeth and jawbone, dental implants are a better restorative option. Dental implants can last a lifetime if properly cared for, and they promote positive oral health, making them the most cost-effective, long-term investment for replacing a missing tooth. Dental implants can be used to restore a single tooth site, as part of a bridge to restore multiple missing teeth, or they can anchor a full set of new replacement teeth, making them a versatile option that suits most patients' treatment needs. Before undergoing dental implant placement, some diagnostic imaging may be necessary to create your treatment plan. Dental implants require adequate jawbone height and width for optimal results, and 3D X-ray scanning is the only way to accurately evaluate your condition. If you are receiving an implant in the upper jaw, the bone between your mouth and your sinus cavity will be evaluated. If the bone in this area is too thin, it may be necessary to perform a sinus lift during placement. If you're receiving an implant in the lower jaw, the nerve that runs along your lower jawbone will be evaluated. It's imperative to be aware of this nerve's location, as damage to it can cause temporary or even permanent numbness in the jaw area. 3D imaging allows us to properly evaluate the area surrounding the empty tooth socket, ensuring that an implant is never placed on top of or too close to this nerve. If you've not received a 3D X-ray prior to visiting our office, you may receive one during your consultation appointment. We understand that you may be anxious or nervous about undergoing treatment. It's your doctor's top priority to make you feel safe, comfortable, and well-informed before, during, and after your surgery. A variety of anesthetic options are available to make your procedure more relaxing and pleasant. You may choose to undergo treatment under local anesthesia, which will numb the area being treated. You will remain awake during the procedure and may feel some pressure, but you won't experience any pain in the surgical area. Some patients choose to augment local anesthesia with nitrous oxide sedation. Nitrous oxide is commonly known as laughing gas and is an excellent option if you're nervous about the upcoming treatment or wish to be more relaxed during the procedure. Finally, you may choose to undergo treatment under IV sedation. This is an ideal option if you'd prefer to be asleep during surgery. During IV sedation, you will drift off into a sleep-like state and wake up when the procedure is over. When you wake up, your mouth will be numb and there won't be any pain. Most IV anesthesia patients have said that the treatment is over before they even knew it had started. Your doctor will evaluate your health history and preferences during your consultation today to select the best anesthetic option for your treatment. Your doctor will provide you with important preoperative instructions prior to your surgical date. Following these instructions prior to undergoing anesthesia is critical for your safety. After administering your chosen anesthetic option, the site of your dental implant placement will be prepared. Following placement of a single implant, a healing cap will usually be placed on the implant. If a healing cap cannot be placed, the implant will be covered and stitches will be applied. If you're restoring an entire arch of teeth, your temporary set of teeth will be affixed to the implants following the procedure. Your numbing medication should wear off over a couple of hours after your surgery. You will want to eat a small amount of food to avoid nausea when you take the prescribed pain medication. Your doctor will provide you with detailed instructions for the care of your mouth before and after your surgery. It's critical that you follow these instructions to best position yourself for a successful recovery. It's not uncommon for our patients to express that they have had some mild swelling, pain, or bleeding during the healing period, which subsided after a few days. There is some amount of risk associated with undergoing any surgery treatment, including the placement of dental implants. Dental implants may fail for a variety of reasons, which should be considered prior to undergoing implant placement. It's also important to be aware that any time you put a foreign object into your body, it can be rejected. A common reason that dental implants fail is exerting force on the implants too soon. This can occur if you begin to eat hard foods or place pressure on the implant before it is completely healed. You should eat soft foods on the side of the implant until otherwise directed. Dental implants generally require 3 to 4 months of healing following surgery. If bone grafting, such as a sinus lift, occurs, the healing period may be longer. Your doctor will provide you with a custom post-operative care plan for optimal healing and results. Oral hygiene plays a vital role in dental implant success. It is critical to keep the area clean following your surgery. Infection can also cause implant failure. Following surgery, finish all of your prescribed antibiotics even if you do not feel sick. Some post-operative pain, swelling, or bleeding can be expected. Usually, within a few days, these symptoms will subside. Your doctor will give you a prescription for any discomfort, and instructions will be given to you regarding other potential post-operative issues. It's also possible that adjacent structures, such as healthy teeth, nerves, or the sinus cavity, can be damaged during treatment. Damage to these structures may result in a temporary change in sensation in the lips, chin, or tongue. There's a significantly lower risk that this change would be permanent. As discussed, the sinus cavity may need to be entered to complete your treatment. This can increase the risk of sinus complications, which can require additional surgery. The risks of undergoing anesthesia for your surgery are typically very low. Oral and maxillofacial surgeons have received the highest licensure and training available to dental professionals to administer anesthesia, and oral surgery teams are well trained and equipped to handle any emergency situations. You can assist in minimizing the risks associated with undergoing anesthesia by completely disclosing your health history and any medications you're taking, whether they are prescribed by a doctor or not. You can also help by adhering to the preoperative instructions provided to you by your doctor. Both of these actions can significantly lower the risk that is associated with the use of anesthesia for your surgery. We hope that you have found this video helpful in understanding your upcoming treatment, the risks associated with your surgery, and the benefits of restoring missing teeth with dental implants. If you have any questions after viewing this video, we encourage you to ask your doctor, even if you may be hesitant to do so. This will allow your care team to provide you with all the information you need to understand the treatment options and instructions for post-surgical care.